Greetings, and thank you for joining us today. My name is Craig Day, and I'm the program executive for AIAA's Ascend event. I'm excited to be joined today by David Bauman, the director of NASA's Human Research Program, and Betty Wan, a manager of new portfolio investments at Boryung, to talk about the Ascend call for content and the importance of space healthcare research. You can go to the next slide, please. During our time together, I'll provide a brief overview of AIAA's Ascend event, its associated call for content, and our initiative to solicit space healthcare research. Betty will discuss the Humans in Space initiative, and David will give us an overview of NASA's initiatives in this critical research area. We'll save some time for questions, so please use the Q&A tab in Zoom to send us your questions. Next slide, please. Ascend is AIAA's space-focused annual event. Launched in 2020, Ascend promotes collaboration among the broad space ecosystem. Ascend was designed to provide an opportunity for technologists, engineers, executives, students, and researchers to connect around the challenges and opportunities in our efforts to build a thriving off-world future. We facilitate these connections through a variety of discussion formats, from debates, roundtables, panel discussions, to technical presentations and papers. Much of this content is derived and developed through our annual call for content that we'll talk about a bit more shortly. On the next slide, before we jump into that, I just want to give you some details for Ascend. 2025 Ascend takes place the 22nd through the 24th of July, 2025. Caesars Forum in Las Vegas is a new conference center that provides state-of-the-art facilities and spaces to collaborate for Ascend attendees. For the second time next year, Ascend will be co-located with AIAA's flagship aeronautics conference called Aviation. We're expecting about 2,000 attendees, and you can find the most up-to-date information at the Ascend website. Next slide, please. With that, I want to spend a couple of minutes on the Ascend call for content. Through this call for content, Ascend provides the opportunity for the global space community to provide input to the program development process through submissions of ideas for session topics, as well as a call for technical research papers. This is something you might be familiar with from other technical conferences. Technical papers and presentations shape the content of Ascend and are a critical aspect of the conference. The call is organized by core topic areas that I'll show you in a moment, and new this year, we're soliciting input related to specific domain challenges, space domain challenges. The topics shown here provide the high-level organization of content at Ascend. You can see they're largely aligned with some of the main segments of the space community. These topics are used to organize the papers into themes and to assist organizers in building compelling multidisciplinary sessions into the event schedule. The challenges you see in the second column here were developed in collaboration with AIAA experts, as well as outside stakeholders, to attract new submissions to Ascend in an effort to stimulate interest in timely and emerging sectors of the space ecosystem. Today, we're focused on the space healthcare challenge, but you'll find information on all of these other topics and challenges on the Ascend website. Next slide, please. If you haven't heard of the Humans in Space program before, Betty will tell you more about it in just a moment. At AIAA, we have been collaborating with the team for the last few years, and we're excited this year to introduce this topic to the Ascend call for content. We hope to bring additional opportunities to drive progress in this critical research area by attracting researchers and technologists to participate at Ascend and to present their work to the broader space ecosystem. We're currently in the planning phase for additional content focused on human health to complement the research presentations. As Betty will explain, through this partnership with Humans in Space, AIAA is excited to provide access to the 2025 Humans in Space Challenge for accepted authors that present and publish their research papers at 2025 Ascend. With that, I want to turn the presentation over to Betty Wan, Manager of New Portfolio Investments at Boryung, to tell us a bit more about the Humans in Space program.
Thank you very much, Craig, for the warm introduction. And just like what Craig said, we're really excited about this new partnership between Ascent and the Humans in Space program. We've been this is our third year partnering, and as Craig mentioned, this is the first time we're really calling out for space healthcare technical papers through the Ascent technical paper call. So just to give you a brief overview about what humans in space is and what's the additional benefit that Craig has briefly mentioned for the selected and approved papers through the SEN technical call. So, some of you may have heard about Humans in Space, but Humans in Space is basically a global space healthcare program that serves as a launch pad for space healthcare innovation and research ideas. So, ever since 2022, we have been annually hosting a global space healthcare program, and under the program, we have the challenge aspect where we call for startups and researchers all around the world with innovative ideas in solving critical healthcare problems both in space and on Earth. So, we over the past 2 years or 3 years, we have received more than 200 applications across 31 different countries. And these applications go through like series of evaluation by our advisory board and experts composed of more than 40 individuals who are leading the space healthcare initiatives both in the research field, the commercial field, and the investment field. Another aspect of the program is that we also have the investment and accelerator program where we provide mentorships and funding support for the selected researchers and startups. And lastly, the program also serves as a platform to boost commercialization of these ideas. So as of now, for the past 2 years, we under the program we have 13 startups and 5 research teams that were selected and funded as a cohort, whom we are continuously working with together to further accelerate this space healthcare field. So that's a basic overview of what humans in space. And on the next slide, I'd like to provide a specifics to the challenge awards. So under the Humans in Space challenge this year, we had the equity and the orbital launch funding, two tracks of funding or investment provided. So the equity investment is around $50,000 that is geared towards startups with early stage space healthcare ideas, but yet without a concrete on orbit experiment plans. These teams are eligible to apply for the second investment type, which is the orbital launch funding. And this is open to both startups and researchers with more concrete on orbit experiment plans. And the funding goes up to $250,000. Again, other benefits aside from these investments include accelerator programs, zero gravity flight opportunity, networking events, and other credits and as listed here. So as Craig has shared, selected fully approved papers through the SEN technical paper call will get the chance to automatically advance to the second round of evaluation for the orbital launch funding track next year. And on the next slide, if you can go to the next slide, I'd like to briefly go over some of the, I guess, topics that are included under space healthcare. I'd like to emphasize that the I guess risks or topics that are listed on this slide were not limited to what is listed on this slide, but just to give you an overview of what basically this is. So uh, the topics are mainly categorized into two. We have the critical problems in space and critical problems on Earth, reflecting the priority risks that we have got from NASA HRP and ISS National Laboratory. So basically, we're looking for ideas that benefit human life both in space and through space. So when we first look at the critical problem in space, we have domains that cover inevitable crew health and performance, related risks and countermeasures during space exploration. So we have the medical operation part that covers the countermeasure addressing the risks, some of the risks that are listed on the right. And we also have the life model part, which covers the research aspect, characterize and identify solutions to address these risks. On the second part of the category, we have the critical problem on Earth that covers like healthcare problems on Earth that could be solved through the microgravity environment. And that also covers the research aspect and also manufacturing in space, such as 3D bioprinting or tissue engineering, per se. So that's an overview of some of the space healthcare topics that are covered in this technical paper call. And to give, I guess, a better perspective of what space healthcare is and what are NASA HRP's initiatives under this, I'd like to. It's my great pleasure to introduce our guest speaker here today, Mr. David Bauman, the NASA Human Research Program Director.
Great, thank you, Betty. It's fantastic to be with you all this evening, this morning, this afternoon, wherever you might be. You can go to the next slide. So I'm the director of NASA's Human Research Program. And today I'm just going to give a very high-level overview of what the Human Research Program is and what some of our key topic areas are that we're addressing. So you can go to the next slide. So at NASA, our vision is exploring the secrets of the universe for the benefit of all. And I really love the slide that Betty showed a few minutes ago, showing, we're covering all of science here at NASA, but when you look at healthcare, the research that we do in space is influencing the healthcare on Earth, and conversely, the healthcare that we advance here on Earth is really helping us in space. So really looking forward to some of the ideas and some of the innovations that the people on this call can help bring as well. All right, the next slide, I'll talk a little bit more about the Human Research Program. So we've been doing research on humans since we started flying, and even before we started flying in suborbital and in low Earth orbit. But around 2007, the Human Research Program was stood up at NASA with a very clear mission to enable space exploration beyond low Earth orbit by reducing the risk to human health and performance. I will put all the links you see in the chat at the end, but if you want to learn more about the Human Research Program, you can check us out at that link there. All right, so you're going to go to the next slide. And so when we talk about risk to human health and performance, what we're really talking about is looking at what's different about the space environment. So we call those the hazards of space flight. So we have space radiation, isolation, confinement, the distance from Earth, lack of gravity, and hostile closed environments. As we look at different missions, whether it be low Earth orbits, moon missions, or missions to Mars, we balance those against these hazards, and we decompose those into risks. So you can see the groupings of the risks here by hazard, and I'll give you a link where you can learn much more about this, so you don't have to look at the small print here. But just as an example, space radiation, we know that exacerbates the risk of carcinogenesis. Isolation confinement, we worry about behavioral medicine conditions and how we can provide countermeasures for those. Distance from Earth, with our missions to the International Space Station, we can get crews back within a day or sooner if needed. As we go to the moon, those are 3 or 4 day missions. And then, of course, Mars is much longer, orders of magnitude longer, 6 months to get there, at least at the minimum, and then you're on the surface and coming back. So all of these risks get exacerbated as we move out. But luckily for us, we have our ground analogs, and we have low Earth orbit, and now we're going to have the moon to start understanding these risks and reducing them. So the next slide provides just a resource for you all to really dig as deep as you want into all of this. And the link down there, humanresearchroadmap.nasa.gov, it contains links to all of those risks. It has evidence books, so a nice summary of everything that we have learned relevant to those risks. It provides the knowledge gaps that we currently have in our risk plans, and then the current tasks that we have. So we're fairly transparent about where we think we need to be going to understand these risks. But we're really excited about this new a track in space health and the work that Boryung has been doing to help advertise these gaps in these tasks that we're doing to get everyone's innovation ideas on how we help reduce these risks for our crews going to the moon and then onto Mars. Okay, next slide. So that's really talking about the research side of it, the risks and gaps. If we look at it at a different slice, we're talking about capabilities. These are the big long poles that we see for crew health and performance in going to Mars. Earth independent human operations. As we look at longer and longer communication delays and the inability to return people to the Earth, our crews are going to have to be performing more and more independently. Of course, they'll still have communication with the Earth. It just might be a little bit more delayed, but we need to be enabling them to perform autonomously. The Mars Duration Food System, we need food systems that can last between 4 and 5 years, and then provide food that's nutritionist, has nutritional content, and also it's food that the astronauts want to eat. So I'm not going to go through all of these. You can look at more of these, but this is really the long poles that we're looking for innovative solutions on as we try to march down a more measured path on our end. Next slide. So all of our research starts on the ground in our laboratories, in our ground analogs, but we've been very lucky over the longer than 2 decades to have the International Space Station in low Earth orbit as a proving ground for a lot of understanding the risks and the hazards of human spaceflight and also testing some countermeasures. Only about 650 or roughly around that have traveled to low Earth orbit in all of humanity. But this is a really exciting time as we've seen just this past weekend, we marked 24 years of continuous presence in low Earth orbit. So we've had a lot of opportunities to understand the human in this environment. And then also over the summer, we had 19 people in low Earth orbit at one time. And that was an all-time record. So as humans, we are getting more and more people into space, more and more people at the same time. And with commercial space coming online, that's only going to increase. I should have mentioned part of those 19 people were the 4 members of the Polaris Dawn mission. So a total commercial venture. Next slide. So I mentioned we've had the space station for a little over 25 years, permanently crewed for 24 of those. So we're looking forward to the next chapter in low Earth orbit. So we currently have a number of funded commercial partnerships. We have private astronaut missions. So we're working very closely with commercial space to build up those capabilities. So we maintain that capability for commercialization and for the work that we still have to do to characterize the human body in space and help reduce those risks. All right, so we can go to the next slide. So what our goal is for the human research program is really understanding these risks for exploration missions. And we talked about that. We're looking at going to the moon first, then onto Mars and beyond. So the next slide. And so I can say that when we stood up in 2007, it was very aspirational work. But now we actually see the exploration missions are here. We've recently launched the first Artemis 1 mission, which was a test mission of the Orion vehicle and the SLS launch vehicle to take the system around the moon and return successfully to Earth. On the next slide. Our Artemis 2 crew has been selected and they're currently training. So we're planning in the next year to have Christina, Victor, Reed, and Jeremy actually launch in that vehicle and orbit the moon and come back as part of the Artemis 2 crew. And then all of these moon missions build upon themselves as we test out new capabilities and also understand the human body. And so we look to Artemis 3, where we're going to have the first woman and the first person of color, not just exploring the lunar surface, but exploring humans in a 1/6 of gravity environment. Yes, we did that 50 years ago in Apollo, but the first moon mission will be at least twice as long as the longest Apollo mission. And we're just going to keep building on that. And it's going to provide a platform for us to understand how we live on these planetary surfaces, how we live and promote crew health and performance as we look forward to our first Mars missions. So the next slide. The awesome thing about Artemis is we're not doing it alone this time. We're doing it internationally. Over 43 countries have signed our Artemis Accords. You can see them here, and that's growing. And it's really looking at providing a framework for peaceful exploration of deep space. So looking forward to moving out into the universe together with our partners. Next slide. So this is a very high level. I've provided you some links to learn more. But if you really want to dig more, we have our annual NASA Investigator Workshop. It's every January this year. It's going to be January 28th, and it's in Galveston, Texas. It's a great time of year to come to Texas, but there'll be over close to 2,000 people participating either in person or online to learn. It's really a report out for our principal investigators on the progress that they've made. We have commercial space there. Our international partners are there. So it's a really great community to talk about human health and performance and the research going on. So it'll be a great precursor to the AIAA conference then in July. So registration link is there. It's actually free to register. So I encourage you all to either join us in person or virtually. So the next slide. So I really appreciate the opportunity. I'm excited about AIAA expanding the breadth of their already awesome conference to include human health and performance. Thank you to Boryang. It's great working with them on these topics as well. And just looking forward to working with all of you on your ideas on how do we advance human health and performance as we're looking forward to taking our first giant leaps on Mars. So the next slide is just the links I provided, and I'm going to put those in chat for you as well. So thanks again for joining us this afternoon, and we really look forward to seeing you all in Vegas in July.
Thank you so much, David. We very much appreciate your participation today and the insightful overview of NASA's Human Research Program. And we're excited to collaborate with you and to bring some of this exciting research to the Ascend community this coming year. Before we get to some of the questions, I wanted to give you a bit more insight into why you should consider submitting an abstract to the Ascend call. Accepted authors will have the opportunity to present their work to a broad audience of space professionals and connect that research to current missions and challenges. Your final manuscript will be published in AIAA's Aerospace Research Central repository, where it will be archived with other cutting-edge aerospace research dating back to 1963. Collaboration and networking is a core component of the Ascend experience, and your participation will expand the reach of your work. There's also some additional benefits associated with the Space Healthcare Challenge that we've talked about specifically today that I'll ask Betty to speak to.
Yes. So basically, once you are selected and approved as a fully submitted paper in the Ascend technical paper call under the Humans and Space Healthcare track, again, you will be given the opportunity to apply for the Humans in Space Challenge Orbital Launch Funding track, wherein you get an automatic advancement to the second round of it. And within that program, you also receive opportunities for mentorships and to advance your on-orbit research idea. And also, as I've mentioned, because this program runs in an annual basis, there are also similar researchers and startups within the cohort pipeline that you could also network with to further identify collaborators and discussion partners for the problem that you are addressing. So again, we're very much excited to receive different types of ideas that will be coming out or submitted through this track. And we really hope to see you also next year at Ascend.
Thanks, Betty. We've got just a couple more details to share. So next slide. Oh, you're there. Thank you, Monique. If you're wondering how you submit an abstract to Ascend, the website is there for you. If you don't get that in time, it's ascend.events, and it's easy to find there. If you do not have an AIAA account yet, there's an easy way to create one so that you can submit an abstract. When you do that, please be sure to check the space healthcare option in the submission site to be eligible for the Humans in Space Challenge. I meant to mention this earlier, but when we had a little technical difficulties there, I forgot, so I apologize. But the submissions will be reviewed by a group of technical experts, subject matter experts, that are volunteers at AIAA. And if accepted, you must submit a final manuscript and attend Ascend in July to present your paper to get published and then be considered for the humans in space benefits that Betty just explained. So then our final slide, before we address some of the questions, just some dates to remember. The first deadline is coming up later this month on the 21st of November. That's when the call for content will close, and that's what the deadline for submitting your abstracts or ideas. If you're interested in the opportunity, please don't wait too long. Please read over the website and begin the submission process when you're ready. And then mark your calendars for the other dates here and plan to join us in July. With that, I want to thank all of you for your attendance. I want to thank David and Betty once again for joining me. We hope this information was helpful, and we look forward to welcoming many of you to Ascend next year. And I think we've got a couple of questions over here that we can talk through. The first one was about protecting patents in presenting your research. By no means am I an expert in this area. I would ask you to consult with folks at your institution or your company about how best to do that. There is a good bit of information on the AIAA.org website about presenting papers and technical research, and I would direct you there to take a look at some of those policies. There's another question about whether a forward-looking review or roadmap paper would be acceptable for submission. We accept all sorts of different submissions each year. Again, they are reviewed for applicability to Ascend and appropriateness to be presented at the event. So I can't comment necessarily on whether or not it would be accepted. It would certainly be accepted to be reviewed, and then the committee that does that would either accept or reject that abstract and follow up with you on any feedback. Let's see, I think I answered one online, or no, there was another one here that I missed about sharing the recording. We are recording this, and you will get an email after the event with a link to the recording and the slides. So that will happen after the event. And then there was another question here about, will the meeting papers only be published on the ARC, which is what the AIAA archive platform, and that is correct. That is where it will be published. And then one final question here. Is AIAA membership required for submitting a paper? No, it is not. The call is open to the global community. There's no stipulation or requirement for AIAA membership. We certainly encourage everyone to become an AIAA member, so please consider that, but not required to submit. There is a question about Ascend registration being waived. There is a registration fee to attend and present and publish your paper with Ascend, so you do need to register. Oh, there's more questions here than I thought. I'm sorry. Do you have to apply separately for the humans in space component? Betty, maybe do you want to talk about that one a little bit?
Yes. So once you're selected and once your paper gets selected and you're able to present at 2025 Ascend, you get the opportunity to apply for the Humans in Space Orbital Launch Funding track. And when you do that, there's a separate additional document that is requested, mainly focused on, of course, what are your plans for the on-orbit research. But as I've mentioned, this track will be different from the usual track where you have to go through the first round and the second round evaluation. Once your paper is accepted, you will automatically advance to the second round of evaluation.
Great. Thank you, Betty. And maybe we'll just have one last one here. And maybe, David, this is more directed at you. It says, has anyone looked at how the needs for human healthcare should evolve and grow as a given type of lunar community grows from a small outpost to large commercial environments?
At a very high level, yes, that is definitely what we're doing at the human research program, looking at how we evolve those systems, and then working closely with our commercial companies as well. And I'll put a link in the chat for NASA's Moon to Mars architecture, or you can Google that. And that really shows you the whole agency roadmap for how we're going to use the moon to get to Mars, and that does include crew health and performance.
Awesome. Thank you very much. I think that covers all of them. So I want to say thank you again to everyone for joining us. I will put, I'll just, you can reach me. My email address is easy to understand. It's CraigD, CRAIGD at aiaa.org. And you're welcome to contact me if you have any additional questions or if you need to get in touch with anyone. And with that, we'll give you some time back today. Thank everyone for their participation and look forward to seeing some of those submissions and hopefully seeing you at Ascend. Thank you and have a great day.
Thank you.
Bye, everyone.